Hi, everyone. Thank you so much for joining us today. My name is Ashley Gronick. I'm the Chief Marketing Officer for Donor Relations Group. I'm also one of our project specialists, and I am joined by Angie Jones and Christine McGuire. Both are consultants with DRG and have a lot of experience in the healthcare field. All three of us do, actually. So we're so
Mhm.
excited to talk about any questions that you have today. I know there's some of you who are joining us for the very first time, so welcome and thank you so much for joining us today. Either during your lunch break or morning, let us know where you're tuning in from. It is 1 o'clock here in Northern Kentucky, so I want to go ahead and just welcome everyone. Let us know where you're tuning in from, and we always like to start our webinars off with a question of the day. Sometimes they're fun and kind of off the wall, but today we want to know what you're working on this week. What projects are you working on? What challenges are you solving? What do you have coming up that you're thinking about so that we can kind of dive into some content that is most relevant to you? And while you're doing that, I'm going to let Angie and Christine introduce themselves and talk a little bit about their experience.
Awesome. Hi, I'm Angie Jones. I am a managing consultant and strategist with the DRG Group. I retired recently from the University of California, Davis, where I got to work with this fabulous human, Christine McGuire. But I've been doing consulting with Lynn probably since about the beginning, so for over 10 years. I've had the great privilege of both working for a community-based hospital in Iowa, where I was originally from. I'm now back in Iowa. Um, then I got to work for an academic medical center at UC Davis, where I got to work with Christine. And in the time I've been a consultant with the DRG group, I have worked really closely on some projects with Memorial Sloan Kettering, Cleveland Clinic, Eastern Virginia Medical School. So I have a broad range of community-based, really specific centers, as well as regional like academic medical centers. So just wanted to give you a little background about why me and why I'm participating today. So looking forward to getting to know all of you today. And we have a small enough group that I hope we can make it really interactive. But I'll let my colleague Christine introduce herself too.
Wonderful. Thanks, Angie. Hi, everyone. I am Christine McGuire. And as Angie has said, we are current past colleagues over at the University of California, Davis. And I am going into my 25th year here at UC Davis. And my experience in health is I spent 14 years over on the health campus. And I did everything over there originating with endowment work, but then I started with building the first Grateful Patient program there, running kind of the annual fund, the employee giving programs, and kind of everything that fell within the service needs of UC Davis Health. So just lots of experience getting to know faculty, physicians, and really learning how to kind of put them in our own portfolio and steward them along the way.
Mhm.
And then a couple of years ago, I guess it's been about 3 or 4 years ago now, I joined the DRG team as an associate and have also, like Angie, been working with
Mhm.
some of our clients out here around the country, Oregon Health Science Foundation, and more recently, Montefiore Einstein in the Bronx. So lots of different experiences. And like
Mhm.
Angie, we're excited to jump in and see how we can help support all of you all.
Awesome. Awesome. Well, in the chat, Christine, we're starting to see what some of these friends of ours are starting to, that what they're focused on, what they've been working on
Mhm,
this week. So everything from annual fund mailings to donor appreciation events. We love donor appreciation events.
mhm.
Um, let's see, what else did we see on here? Um, let's see, grant reporting and grant writing. So Patty, you do it all. not just, not just related to donor relations, but all kinds of very specific. And again, endowment reporting. Leslie, what time? So when does your year close? So you're reporting on what year? I'd be curious to know. They're for 2024. Okay. All right. Very good. Very good. Well, oh, revamping recognition societies. Yay. Yay. Okay, good. So this is really fun and helpful for us to start to get to know. Oh, hi, Lisa. We got some questions from you in advance. So thank you so much for jumping in here. What we'd love to know is, is there something specific you'd like to start with? I mean, this is meant for you, for all of you. So if there is a burning question and again, like as you heard in our introductions, Christine and I have been around the block a few times
Mhm.
and we've worked with and for lots of different types of health systems. So, um, is there something specific you'd like to ask in the chat?
I think we need to give them all a moment. We now know what they're working
Stewardship
on,
reports. Yes, this is so great.
but what do you need help on?
I know one of the things, I'm just going to just jump in here because one of the things, Lisa, we asked a few of you in advance if you had any very specific questions. So Lisa at Montefiore, right? She said, how do you determine what acknowledgement parameters and what giving levels, for writing personalized or hand signed letters for leadership? So can we start with that question, Christine? You
Yeah,
think?
that sounds great.
I think that's a good one too.
Mhm.
It's just it's our first pillar of donor relations. So one of the things that we like to do, especially when we're doing an assessment, is take a look at all of your data, right? We like to see how many gifts are you getting in a year? At what level do they start to be considered a leadership level gift? Is at your hospital is $5,000 and above a pretty leadership level gift? Is it 100,000 depending on where you are? At Montefiore, my goodness, I know you guys get some just really. I was talking to Holly, one of our colleagues, and she says she's writing like really big acknowledgments, right? Big, big gifts. So I think it really depends. If you think about leadership acknowledgments, it should be that top 5% or less of your giving should be receiving some type of a hand signed, more customized, personalized acknowledgement. Now, you can still personalize an acknowledgement at lower levels and still make it, address it to Christine or to Ashley or to Lisa, right? You can still personalize it, but if you're talking truly custom and we're showing in the letter that we know them, you want to keep your leadership only signing, a couple of hundred of these total a year. Would you agree, Christine, or anything you would change about that?
No, use your data, segment it, see what levels you have your donors in. At UC Davis, just as an example, we have that at the 100K and above level. And that is over 100 letters that we have our chancellor signing on an annual basis. And as Angie said, those are the ones that are a lot more personalized that we're going to
Mhm.
roll in front of a development officer because we want to make sure and know, has the chancellor seen this donor? Are they coming to visit campus? We want to make sure that it's very familiar and
Mhm.
that we're capturing any kind of activity that took place there. So I
Mhm.
think a quick and easy evaluation, but you don't, as Angie pointed out, we don't want to bog them down with, 400 letters.
Right,
That's a
right,
lot for your leadership to do.
right.
So segment it and kind of make the decision. I see somebody else here saying, glad to hear the 100K threshold. That
Yeah.
that feels about right. But
But I'll tell you, Christine, when I worked for the Mercy Medical Foundation here in Iowa, this is years ago. I mean, $10,000 to us
mhm,
was a major gift. So, and that was a very doable number that I could get my CEO to sign. So I think it just really
mhm,
depends on the type of organization and what is considered a major gift. It also depends on your leader. I mean, you know, I've worked with some amazing leaders who are like, I'd rather sign more and you know, make little notes on so you can give me more. So you have to sort of also know your leadership to know that, but um, use their time sparingly, right?
Yeah, totally agree
Uh,
with that one.
awesome. Feel free, you guys in the chat, to this ask us questions, but I do want to let's
Angie,
see.
we could address this one up here from the YMCA Greater Seattle.
Yeah.
The one I was going to respond to was really about, let me see. Sorry, there's a couple here. There was this one really about like how long it takes, and I guess my comment, so the questions are about with healthcare providers, getting them on board with storytelling when their instinct often defaults to
Mm,
protection and suppressing any outcomes other than data. Logically, they understand the need for fundraisers and donors, but they still refuse to share or even consider asking patients, are there strategies and approaches that would work? So I guess one thing I wanted to point out here, and you're all working in the health care field, so you
mhm,
know that, but these relationships between development, frontline fundraisers, and our physician faculty members they can be challenging at times. And I think it's important that you give it the time and the respect that it needs. We're not going to automatically walk in and unfortunately be respected by our doctors and the people we work with. It's a two-way street and a two-way relationship. And
mhm,
just from my experience at UC Davis, it it kind of took proving myself that I had something to offer and that I was serious
mhm,
and that I had a plan in place and that I was approaching them very thoughtfully, understanding that that patient relationship was the most important thing that they possibly had. So I
mhm,
think you have to build that first before you can expect anything from them. And
mhm,
then the second piece of this, I may not be addressing it exactly, but the second piece of the puzzle that I would add is you also have to work with the ones that are willing to work with you.
mhm,
You'll find that you have a handful of physicians that are very open to working with you and others that are not. But I've also seen experiences where a gift coming in the other way can
mhm,
change the opinion of that physician, faculty member, whoever it is, because
mhm,
now they see the benefit of it. And when you're able to tell them stories that when you can share patient stories, how meaningful it is to other donors out there who want to give.
mhm,
And it's also meaningful to that donor and that family that they're
mhm,
actually able to make those gifts.
mhm.
So treat them like they're in your portfolio and steward those faculty members the same way you would a donor. You
Mhm.
want to add on to that, Angie?
Well, the only thing I was going to add is I've had really good luck in saying to a physician, do you know, instead of you making the decision about whether they want to tell their story, could we ask them because they might want to use their experience with you, with this healthcare organization to tell everybody how great the experience was. They might want to tell their story. And if they don't, we will respect that. But we want to at least give them the opportunity to do that. And I was, you know, often able to convince them to be able to do that based on that feeling. So yeah, I love that. Okay, so we have a question here from Jennifer. She's asking best practices for distilling heavy science for donor impact reporting. Oy, yes. Yes. I The average reader reads at an 8th grade level, and our scientists have 47 degrees, right? You know, the researchers, the physicians, and they want to use all the big words, right? So the way to do AI can really help you. And I don't, I'm a AI novice. I'm just going to say that. But if I can't understand something I've read, or it's a little too complicated for me, I will plug that information into AI like ChatGPT and say, can you explain this to me in a way that I
Mhm.
could, that I could understand it? And man, it really works beautifully. You mean you can't take everything. You're going to have to, you got to take what they're giving you and then add your own knowledge and information and double check it against the research. But that is one of my latest tricks, is being able to do that. The other key thing I think to note, and I'm working with a current client in Australia, and they think a good impact report is long and
Mhm.
lots of information. And at about 4 pages, we start to lose our donors, right? So we have to really be mindful of how much time our donors are going to want to spend reading, digesting, taking all of this information in. So I guess those would be the two things I would say. Christine, is there anything else, any other tricks you might have about distilling sort of that difficult scientific information?
Well, I was really going to go down the path, following up on what you said, that it also depends on who the donor is,
True.
right? We
Yes,
have some donors that are
true.
actually the faculty members in some of these areas. The
Heck yeah.
last thing we're going to do is try to out science the person doing the work.
Yeah,
So
yes.
there's all kinds of different circumstances. If it's somebody who is going to be okay with the heavy science, I love the AI part of it. I use that all the time. I think it's a great way to do it.
Hmm.
Um, but we can give them things that are a little more complex. But if it's a donor that maybe the complex we've learned is not really their vibe, then
Hmm.
putting in an AI and coming up with a way to
Hmm.
simplify it is a great way to do it. But my
Hmm.
point being, it really depends who the donor is. I
Hmm.
was also going to add,
So
go
smart.
ahead, Angie.
No, so
Did you have
smart.
something?
I'm just
Okay.
like right with you, girl.
We have lots of questions now that I'm seeing over here that are about impact reports. And I
Can I
think,
I want to add one more thing to the heavy science.
yeah.
Is there a way to put it on video and have someone tell the story or show the piece of equipment, or to walk them through something? Video can be a super powerful tool also for donor impact reporting. So okay, all right, there's so many good
Totally,
questions.
totally agree. And I think we need to think about that it's not just a written document.
Yes.
It could be a written document accompanied by a video.
Yep.
Maybe it's being done on ThankView and you're putting it in the PDF viewer, and then your faculty member is giving an update. And I love Angie's great at stories. So having your faculty tell their science through an example of a story, or maybe
Hmm.
how they were able to so I hate to say just a cure, but support a patient in some
Hmm.
way because of it.
Hmm.
And then we have all kinds of questions
I know.
on
Can I just
impact
add
reports.
one more
Yes.
cool thing? Do you remember when we at UC Davis had Alan Alda, the
Yes.
actor, come in, and we picked some of our top scientists at UC Davis, and he has this class that he does where he teaches these very well educated, scientists and researchers how to tell their story, so how to explain their research in a way that people can understand it. And man, that was so cool to see the light
Hmm.
bulbs going off for researchers. So there is also training that can be done to help these researchers tell their story in a really good
Yeah,
way.
get it into layman's
Yeah.
terms, so we can actually understand
Yeah.
what they're talking about.
Okay.
Absolutely.
So Leslie, you asked, how do you handle personalized impact reporting and how do you decide which donors get them? And is there sort of a standard template, or is each one unique? Can I just say depends? Um, One thing I might say is I would always first think about, is there a strategic purpose for this report, right? That's one of the things I feel really strongly about is, do we want to ask this donor in 18 months for the next gift? Do we have some repair work that we need to do? Are they upset with our organization? Have they been doing something for so long and they've reached some magical milestone of giving, like 20 years, or their giving has now reached a certain level? Is there something strategic about why they would need a report? So I guess that would be the very first thing I would do, is that's how I would determine who gets reports, especially if you don't have all the writers in the world to help you do this. And no matter how big your staff is, you don't ever have enough people power to help you do that. But I do love the standard template and having a consistent look and feel, and maybe even certain types of a flow to how a report would go. So you always want to include, certain sections. So I do love that, um, for maybe repurposing some information for reports for maybe the next level donor down. But personalized custom impact reporting, there should be a strategic purpose and it should be pretty personalized, but then follow your organizational brand. Remember the cool one you did, Christine, for the donors, and we did it all on video for
Mhm.
Mike and Renee. Um, we did the whole thing in video and we interviewed certain people because this guy is like a venture capitalist and he's so busy and they've got grandkids and they're just busy. And so we did it in a short little video. He loved it. They loved it. They absolutely loved it. So again, it can be just knowing your donors. So
Yeah, I wanted to add in there, Angie, as the idea when we talk about video, and this really relates to health, where we had a faculty donor who actually ran a program. So she was intimately involved. She knows everything that's taking
yes.
place there. And it is really associated with foster youth. So
Oh,
these
I
are
love that.
children that we're not going to be able to put them on video.
Right.
We're also, as I said before, not going to be able to tell her the science. We can't out science her. She knows what it is that we're doing. So we kind of flipped it, and instead we talked to the staff and the people that she affects on a daily basis through her work with the children. So people told stories about how meaningful she was and what she did and how it affected the kids. So
Oh.
even though we couldn't put the children up front, it was a really meaningful way for her to feel just very appreciated and really
Hmm.
see the gratitude of others for her commitment. So it was just a neat way to do it. And then the other thing I was just going to add here is Angie and I kind of share a brain on this, so we're saying the same things. Um, we try to make sure that we're not just doing it to do it. There's a reason. There's a
Hmm.
strategic purpose for it. We also know that we never have enough staff for this. I'm
Hmm.
working, some of you might be even on this list over here. We're working with some of you trying to figure some of these out for you. You can't do it all.
Hmm.
So you really
Hmm.
look at your impact reporting and think, what sort of reports can be used, like a broad based that can handle,
Hmm. Hmm.
maybe it's a cool children's hospital story with, four different families and what this has done for them,
Hmm.
that you're
Hmm.
able to send out to all of
Hmm.
your donors in this realm. But
Hmm.
when we get to these highly personalized ones, I agree with Angie that it's important that we have a strategic purpose in place. Are we going to make a six-figure ask or whatever it is in the next, we try to look at the next 6 months?
Mhm.
And where in that timeline is this impact report going to help make a difference? How are we going
Mhm.
to help you close that next gift?
Right.
Because we made sure that we stewarded those donors well along the way and showed them the impact. And now we've kind of set it up for you to get
Mhm.
ready and move forward with your ask. The
Mhm.
worst thing I think we can possibly do is let these come too close to each other and try
Mhm.
to shove in an impact report and then turn around and make an ask. It
Mhm.
feels very disingenuous. It's against
Mhm.
everything we say. It's
Mhm.
almost asking. It's against
Yeah.
everything we say to do.
Right.
So I
I
would
love it.
say be thoughtful, be strategic, sit down with your teams and actually map this stuff out. Think
Mhm.
about what you might need for the year. I feel like this is an area where we have a tendency to be extremely reactive.
Mhm.
Someone wants some, we're going to do one, and they
Mhm.
just pile on
Mhm.
instead of being thoughtful, rolling into the fiscal year and
Mhm.
thinking, what five, what 10 asks do we have that this could be a meaningful touch point for us?
Mhm. Christine, you said broad-based reporting, which made me think that is such a genius way to get reporting and impact reporting out to the many, instead of the individual. And one of my favorite tricks to do this is look at the funds at the most popular funds where people are giving. So at your hospital or at your academic medical center, is it pediatric, the pediatrics? Is it heart or cardiac? Or is it maybe just general fund? Or is it, just supporting people who don't have access to health care? Whatever those funds are, and then create reports around those funds, and anybody, no matter the size of their gift, if they gave to that fund, you create this report and you send it out to them and say, this much money was contributed to cardiac um, care this year. And this is how we utilize this money, and this is how it made an impact. And you were part of the you were part of the team, the group, the family that helped us make this possible. You can't, like, if you can't start with everything, I mean, we know how hungry our people get once we have a good story, right? But if you can like, prioritize it based on those highest earning groups or the largest group of donors that are giving to a fund. Does that make sense, Christine? Did I say that
Yeah.
in a way?
Oh,
Okay. Okay.
absolutely. Yep.
Okay. I think that's really, really good. What do you got?
We have lots of questions over here. Jennifer is saying she doesn't really have buy-in from a video standpoint. Um, and that's a tough one because we need to tell stories.
I
Stories
know.
are what are meaningful. Stories are what really are close to your heart. For me, I mean, health has all the stories. I
Oh,
don't know if I've maybe we can share some examples with you that you could utilize as a tool to maybe talk with your leadership and get them to understand
hmm
how video work like this can be used as a tool. We
hmm
can't reach everybody. Video gives us, the
hmm
pandemic showed us that video gave us a reach that we never knew we really
Yep.
had before. We
Yep.
stayed so concentrated in our little bubble of a world, and pandemic happened, and now we were able to invite all of these people that we hadn't realized before.
hmm
So
hmm
I think that there are some talking points that could assist you there.
Yeah. Also, if you can't do a video, try to do something in person. I mean, the best part about a healthcare or hospital is that you have an active place where people can come and see. So you could perhaps bring people and take them on a tour of something, or show them behind the scenes of something, or let them see how a piece of equipment now works or something like that. So
Hmm.
if you can't do video, because again, video is the most efficient and cost-effective way to tell a story versus paying for an event, bringing people in, paying for parking, paying for food, all of that stuff. And it takes a little more time, right? Of people's time to be able to do that. So
But it is cost effective. Angie, you're right.
It
And
is.
somebody here is asking recommendations. I mean, there are so many products out on the market.
Mhm,
We at UC Davis use ThankView. It's easy. I love that you can send a link out and
mhm.
have somebody record it on their own, as Angie said, with
Just use
with
your
your
phone.
phone. It's
Mhm,
meant as one that could be as simple as holding up the phone and recording yourself, or it
mhm,
could be polished and it could be a
mhm,
video that's dropped in that's polished. I'm
mhm,
only saying thank you right now because it's really the one that's main in my head, but
mhm,
there are tons of them, from
mhm,
Story Raise to there's so many products out on the market right now that offer this to you. I
mhm.
feel like at a pretty reasonable price.
Right. And if you're in a big um healthcare organization, like when I was even at Mercy Medical Center, I mean, it was 800 bed hospital, right? We had a video team. I just had to kind of fight and make my case to get some time from them to do the story for me. And if they couldn't, then I could if they just didn't and they didn't have capacity, then I could outsource. And you could also outsource if you want something more put together, more tailored.
And a follow-up to that, yeah, some of these software and platforms, and it doesn't have to be healthcare. If you're in a large organization, getting some of these things through our IT and security are miserable. I will
Yeah. No.
100% agree with that. We're just trying to get better at it. And I think the good thing is once you can get them through, it's easier the next time. So you have to plan ahead. We have seen some of these things take 6 months or more trying
Hmm.
to get through, and we call them a VRA process. So
Hmm.
it can be complicated, but I will tell you it's worth the fight because these are tools that help you do your job easier, and they're tools that help us tell stories and I feel like are meaningful to our donors. So
Ashley, can I ask you this one from Roberta? Recommendations for software for playing video in an email. Would you have any answers to that? Sorry,
No,
that's not
you're
my,
fine. It really
okay.
depends on what platform you're using to send emails. Every platform has different ways that you can embed. I see there's a question about Constant Contact. Unfortunately, that's one of the few that I don't have experience with. But other platforms I've worked with, typically you can embed a YouTube video into just about every email platform.
Hmm.
So that would be my number one recommendation because you can upload, you can use very simple and free tools like Canva to edit a video, upload it on
Hmm.
YouTube, and then embed that link into just about every email provider that is out there. Again, I can't speak directly to Constant Contact, but I would recommend hosting things on YouTube, even if it's a private link. If you don't want it to be available to the public, you can set that setting and just embed it directly into those emails.
Thank you. Thank you. I knew you would know way more about this than I would.
and if
Um,
we're missing important question you guys want us to get to, I'm trying to go back,
Me
but you're
too.
also welcome to repost. Don't feel bad reposting if you're coming up with something that you want us to cover.
I love also that they're talking to each other and figuring
Help
out
each
who's
other.
doing what, right? This is one of the reasons we do these things is so that you can start to meet your network and build up your network, right? So do it.
Let's
Um,
see.
do do do. We'd like to play live in mail. We would like to play live in mail
That
I
email.
is the
think I
difference. She
think
wants
it's
it to play live instead of having to click out and go to YouTube or go to another
oh,
platform.
I
They
see.
want it to play live in the email. And I will just say that's a question you have to ask directly to your email provider. Talk to MailChimp's customer service and see if they have some ideas on how to do that. Every single one of them is different. So
Hmm.
some can, some can't. Some will have some workarounds for you, and others you may just have to link out.
Yeah, good.
we've had really good luck, I feel like, Angie, at UC Davis.
Mhm.
asking our vendors for things that we need, as weird as that sounds, but
Yes.
especially all of these kind of young up and coming companies. ThankView was that company a couple of years
Yes.
ago. ThankView
Yes.
was that company bringing on Otter, but we have had brought through challenges across the years, like, our need for closed captioning. We have
Yes.
every state has its different laws around it, but we had needs. We had to have that available for us. And we brought these forward to these smaller software companies and vendors. They've always been pretty open to trying to get the things that we need. I think
Mhm.
they really want to live in the development sphere. So it's also worth just, as Ashley said, asking and seeing if it's something that they want to add to their to the software that they already provide. It's
Mhm.
worth the question.
Mhm.
I will also add, this is another very useful way to use ChatGPT that people don't think about. We just did a CRM conversion and I can type into ChatGPT like, hey, how do I do this in this platform? And it searches all of their resource articles, all of the discussion boards, and it'll tell me very quickly whether or not something is possible or the step-by-step instructions of how to do it. So utilize those customer service tools and also utilize AI. It's a lot more useful than just writing an email.
Oh,
You
it
you got some thumbs up
absolutely.
on that one.
I totally agree with you, Ashley, and it's shocking the things that we can put in there. I'm just going to add another thing that I have found that's amazing, and that is when you are trying to gather all of these stats, maybe you're looking for I want all these stats on this certain kind of program or everything that's within the fundraising industry about this topic. I want the quotes and I want the stats that go with it. And it'll pull from all these research articles, pull it together, and you have a one pager now on, this is what I needed for something.
Mhm.
So
Also
just
very
a great
useful for
way.
getting buy-in. If you need to do a quick search of some good talking points or research references to get buy-in for use of things like videos or whatever you're looking for, ChatGPT is another way of combing everything that's out there and putting together a little one pager for your leadership.
Mhm. Oh, good. Maxine's given some advice to
Constant
Robert.
contact. There we go.
Yeah, I love it. I love it.
Keep your questions going so we know where you want to go next.
Let's see. What about one of the questions that was asked was what about if patient stories are off the table? Um, is there some other way to create or stir some emotion for the donor in some different ways of storytelling? That was a question that we got in advance. Data doesn't always have like a feeling.
One of
And
the
are the
most powerful ways I've seen that shown in a video or in an email is instead of telling a specific person's story, make make it a character story. So you're not naming the person, you're still using that powerful story and outcome, but without actually identifying who it is. Give a character a name and tell the story anyway.
Mhm. Yeah, I love that. I love that. And again, I think people do like to do this. We just did a really cool first time impact report for Shriners Children's. Um, and they, the impact report, they're like, how do we tell the story without making it about the kids? But we need it to be about the kids. And we just leaned into what are the areas that funding is supporting, and then we found stories around each of those funding areas and then infused it. In some cases, we talked about the amazing caregivers. And in one story we just found a really interesting way to make some infographics to be able to tell that story. So we brought all of this boring sort of data to life with some key points that we wanted people to get across. So I think there's again so many different ways you can tell a story and maybe not use that specific Angie Jones story, right?
Mhm. Yep. We have a question here from, I think it's Alexis, really talking about the political environment, coupled with mission focused on health equity and population. We anticipate donors wanting to move more to
Mm.
anonymous type giving or having to fundraise in a very quiet way to avoid drawing attention to themselves.
Mhm.
Do you have recommendations on how to steward these donors in these situations where public reporting or visibility? I
Mm.
would just add there, you know, depending on the level of the gift, with some of those donors, I mean, you may want to be sitting down and drafting some sort of an engagement plan with those donors anyways.
Mhm.
Um, and your stewardship can be done in so many ways that doesn't have to be visible to others. It's
Mhm.
about building that private relationship. I don't really think it has to be out loud at all. I think you have to have clarity on, can your highest level, whatever they are, a president, a chancellor, it does whatever the name of that title is, can that person know? Because that's a personal relationship right there. So,
Mhm.
and I said level of gift because let's say it's $1 million donor, and that may be appropriate. Let's say it's a $500,000 donor. That may be appropriate for your highest level uh, individual to have private conversations. Maybe
Mhm.
they're still meeting with some faculty members. So there's
Mhm.
lots of ways to do that that are very quiet and private. I find that a lot of our larger donors are that way anyways. So I,
Christine, remember during the pandemic, we received an enormous
yeah,
gift to UC Davis. And
yep,
what this donor said, if anybody finds out who I am, I the giving will stop. But
yep.
if you can assure me anonymity, and he it was a don't this donor was trying, I'm using he because I don't even know if it was a he
I
or
was
a
gonna
she.
say, we don't even know.
We don't even know. And they gave million what was it? It ended up being over $100 million, I
It was a
think.
lot of money.
But it was, he wanted to try to filter money into a small community that had a community and a college, a university in the same. And what happens when there's this kind of a pandemic, and how do you make sure the university is cared for and the people in the community are cared for? And so we created all of this amazing testing, and this money was used, and we had so many cool stories about how our rates, we got published in the New York Times. Like, we were able, because of this anonymous gift, and
And we
even the New
didn't know
York
who he
Times.
was.
No. So we found ways to be able to recognize that person, whoever it is. Still don't know to this day. I think there were two people, the person who found, that solicited the gift, and the university president, and that's about it. So but anyway, you can do it. You can do anonymity. You can still show impact. So
Yeah, and
that
as
was
we
just
talk
one
about
example.
impact reports, these are still things, as long as you know who the donor is, these are things that you can still do for your donor that are very private. Even when we talk about this, the video gratitude and the things that we do, these are very one-to-one ratio. This
Yeah,
was meant for that donor
right.
and that donor's family to share as they chose. But these are not things, unless we had permission, that we're showing or talking about out loud.
What was the gift that Montefiore just got? And it was to the Einstein School of Medicine. I forget
A,
how large the gift was. Mrs. Gosman
a
made the
billion?
gift.
1 billion. It's a billion.
Okay. And Lisa, thank you. And, automatically, what we were told is, they said, well, we'll change the name of the school, which is called the Albert Einstein School of Medicine, right, to your name. And she thought, like, that was a ridiculous idea. That is not how she would feel recognized, right? Like, she's like, no, it's already named after an amazing human, right?
Hmm.
That did so much for the world. I don't need my name on it, right? So I think a key thing about donor recognition is you have to know your donor, right? You have to know what drove that giving, what made
Mhm.
that person, how did they want to feel um valued, appreciated, recognized for that. And again, it's a very easy assumption to think it's a public recognition thing. And it's in this particular
It's not
case,
always.
yeah. I mean, Lisa, maybe you could add more color commentary here, but I just think that was such a good example of, um, again, women give for different reasons, of course, right? They don't, it's more, they want to change the world, right? They don't necessarily want their name in lights typically. So, but anyway, just knowing that person, I think is important to know. So,
Yeah, and that is an amazing gift.
oh my gosh, my heart
It's
just
yeah,
flutters when I think about she doesn't want anyone graduating from that medical school to ever have a bill.
it's
What?
amazing.
If I had that kind of money, I'd do the same thing.
Hmm.
Yeah, that's just about makes me cry. Um,
That's why we're in our field.
I know we're such easy. Yeah, Christine and I ball at the drop. So, yeah, she preferred more private recognition. Oh, compiling thank you notes from students and
That's lovely.
faculty. I love it. I love it. That's what she wanted. That's all she wanted and needed. And all it took is a little bit of your time, your team's time to pull that together. That's so awesome.
It's crazy how sometimes the largest gift becomes the really the easiest for us to manage.
Yes.
Where
Yes.
sometimes you may get $1 million gift and you have to go through so many hoops
Right.
to keep that donor happy. So it's very interesting, as Angie said, how people give and what their
Hmm.
expectation was.
For sure. For sure.
We have a couple more minutes if
Other
everyone,
questions do we have? We want to use the time however you want to use it. Do. I want a digital donor wall. Yay! Which will replacing our static cumulative giving. Oh,
I made the noise too, Angie. The combo thing is hard.
yeah,
I wonder
yeah.
if, you know, I don't know. I'm trying to think of a solution for that because when you go digital, your goal is to go digital. It's
Mm-hmm.
not to keep things lingering behind. So I was
Mm-hmm.
wondering, instead of putting a plaque up, could you give a plaque to the donor
If
while
they'd want
also
it,
putting them in the digital? I'm trying to come up with an example of instead of doing both
I
and having a plaque wall. I don't know.
I guess Leslie, my gut is saying to me, I would want to know more about your donor base. And if they are younger or if they like physical recognition, I would guess I would want to know that. So maybe a survey to try to find out what's more meaningful. Would it be more meaningful to come in and see this, with digital, you can do more storytelling. I've seen some awesome ones where it's not just Angie Jones's name, but it's Angie Jones's story and her why she gave to the Einstein School of Medicine, right? And that I've seen people just stand there and just read the stories after stories. So it does allow for a little more customization than just your name up on a wall. So I think I probably, if I was in your situation, I might either do a focus group or a little mini survey to try to find out which is more important, seeing your name on a wall or seeing your name added to like a place where you can easily search it. And does that sounds leading? So don't ask me. That was not a very good survey question. That was very leading because I was telling them which is cooler, trying to drive them to that answer. But yeah. Oh, they do watercolor prints at
That's
Montefiore,
nice.
um, for the space that's been renovated. Okay. Yeah, that would be a good opportunity, Leslie. Yeah.
Lisa,
Um,
I'm not sure what question you're I tried to go back up and see, or if it's when you provided
Oh,
to us that
she
you're
sent
asking
him,
about.
she sent some emails about preferred scholarships, professorship reporting tools, platforms, implementation timeline. That was one of the questions that Lisa sent. Our favorite platform is Otter. But I know other people, I mean, as a tool to use to be able to send reports out.
Mhm. This is one of theirs where there's a ton of them right now. Otter, we use Otter at UC Davis now, which is really attached to ThankView. But there's so many products.
Myth
There's
Mythos,
Mythos, there's Overture.
Overture. We did use Overture
We've
at
used
UC
Overture
Davis, and they're
before.
making some pretty cool new developments.
They are.
So, I mean, check them out. It was a little bit for us when we did the research and got their data points back, we saw where our donors were spending time and how much time they were spending on the report that we spent months
Yeah.
putting together. And we're like, wait, why are we making this complicated? All they really want is the down and dirty financials. So
So cost wise, it
it
wasn't
just,
really lining up for us.
yeah,
As you said though, I have seen some improvements in that
me too.
product.
Me too.
So I think you have to go and see.
And from a timeline, implementation timeline, you mean if you move, Lisa, if you move to a platform of some kind, is that what you're asking? We'll wait for you to respond there.
I'll just add from an endowment
How long
standpoint,
to get up and running, she's saying.
depends on the platform. If you're going simple and you really are using something like Otter, there is no really up and running time. You're given a like a client representative who kind of walks you through how to do it, and then you're doing the work on the back end and then using it as a delivery tool to get it out to your donors. And like ThankView, it has the video component, and then it has basically open PDF viewers. So it could show like your financials, if you have a how to read your endowment report, whatever it is. You can also use that for something like impact reports for scholarships. You could use it for maybe your narrative reports for your chairs and professorships.
Mhm,
I look at that product as it's based on your creativity.
mhm,
Because if you need a video and you need something in a viewer, there is your tool. Now, what do
mhm,
you need to put in it? It's deciding, is it going personalized, the one-to-one, or are you trying to send it out to many?
mhm.
So timing are tough for a lot of these because some of these products, there's a lot of work
There
to get
is
up
a
and
lot of
running. Yeah.
implementation, but yeah, yeah.
But we're
So
kind of picking
if,
some that are easy to
yeah, if
use.
that's important to you to, I guess you figure out what's the most important thing. Is it more about a robust storytelling? Then you might be okay to invest a little more time implementation. If it's what's important is getting it done and getting it out the door, then you might consider a different tool. So,
Your last question that you sent to us beforehand is tough for us too on the bonkers of federal guidelines. I think we're all going through the what words we can use and what words we can't use. So I
maybe
feel like,
talk a little bit more about that. So the question, everybody, that she asked is,
thank you.
how do we address this NIH reduced funding, Medicare cuts? How do we talk to our donors and our audiences about what these cuts mean to our organizations and how it puts us at risk? Um, it's a really good question, and we've been kind of grappling with it. We've seen a few organizations do it really, really well, Lisa. Duke Medical um, came out, I think it was in February or March, with some really awesome just here's what this means, right? Like, and they put it on their website and here's what this means. I think we have a few links. Oh, thank you so much. Johns Hopkins also did something really, and again, I think really, really well. So we put in some of the links. We saved it, and just because we get this ask this question for our clients, so it's nice to have to be able to. So if this is helpful to you, you guys, please, save these. And if you're doing something or you figured out a way to communicate with your donors about these cuts and what this means, please, we'd love to, send them to Christine, Ashley, or me directly at donorrelations.com, because we will make sure to share it out as well, because it's just tricky. But I think the thing is, be honest, right? What these two institutions that are very well known and great notoriety are saying is it's going to slow down the work that we're doing. Which means if we slow down our work, some life changing things won't happen as fast as they could, as if we had sort of this funding. And so they were just really, really honest about it, not scare tactic, because I don't think that works for people. And people don't want to hear a doomsday sort of message. I think it's just like, give me the facts. So anyway, okay,
Yeah, I
good.
think how we tried to be honest during the
Yeah,
pandemic.
right. Just
You know,
just say it, right?
and yeah, I did a webinar yesterday on the, leveraging change, kind of how do we manage it? As Angie said, being transparent, being forthright, being honest. And
If
right
we don't,
now we're kind of struggling with this along with
yeah,
everybody else feeling
yeah,
out what's the right messaging.
yep.
Do you have ideas for meaningful gifts that can be given to Board of Trustee members for birthdays, donors in a giving circle, and just overall gifts to have on hand for meetings with donors that are dedicated?
I think culturally, Megan, if this is something that your um, healthcare organization likes to do, then lean into it, right? And try to find something that's meaningful to the organization. Um, we we've a lot of what we've been learning about donors is they don't like gifty things. So if you're going to do something, sort of think about something that's consumable or can be used, right? So like we're a big ag school, right? So we would give sun-dried tomatoes that our students would be grown and dried on our farm, or we have honey because we have a big honey farm, like, so there's things that you could do that's consumable. So I don't really like to just give people, you know, mu
Meaningless tchotchkes.
mugs like this. I will tell you, our UC Davis Foundation board liked to have their name on things, and so they would every once in a while they'd want a sweater vest or a zip up, a quarter zip or something. Um, I'm not convinced that that was a meaningful thing or not. So again, I would ask what your donors like, at least if culturally, if that's important. I know on the East Coast, when I worked with EVMS, they did a lot of gifts, and it was things that were sort of that area. So I don't know if that's helpful. Gosh, I'm sorry.
Even like I can't remember who it was talking about the watercolors. I think they're things when they're very attached to your university, it can be
Hmm.
kind of cool, especially
Yeah,
when you have something that's very traditional.
yeah.
But, you know, we also are lucky we are now able to sell our wine.
I
So
saw
that's kind
that.
of a cool, yes, we
I
had to
saw
wait for
that.
you to leave
I know,
so that you
thanks a
weren't
lot.
trying to buy it all.
Probably.
Um,
True, true.
but that's a fun, cool gift, and it's so associated with who we are. And our
Hmm.
students made this. So there are some neat things that you can do.
Alexis, yay. I love what you just said.
Yeah.
Gift them an experience, something that they would never get themselves. Let them go see a brand new piece of equipment before anybody else. Let them see the new surgery center before anybody else. Send them insider. We know our donors want access, information. I'm forgetting the third one. access information.
Experience.
Thank you. And experiences. Lord of mercy. Sorry.
My brain was empty.
Apparently I'm getting hungry because it's the lunch hour. So gone. Anyway, well, I hope this was helpful. I mean, we're almost at time, so it was fun for us just to chit chat and share information and share things. So if you have additional questions, Christine and I and Ashley, if you have marketing questions about anything healthcare, that's what she was doing before she joined us at DRG. But send us an email, and if we can answer it, we will. We want to.
Yeah,
So
we appreciate it. It was fun.
we
Love the
appreciate it.
health industry. It's my
Yeah, I
favorite.
know. I know.
So happy just to sit and answer questions about it. So
Yeah. Yeah.
thank
Yeah,
you.
thank
Awesome.
you all so much. Angie, Christine, thank you for being on with us today. For those of you who joined us for the first time, thank you so much for tuning in. I will be sending out an email to everybody who is registered with, I'll make sure I include all of our contact information and some of those links that we shared, and a couple other resources that you might find helpful in your work. So be on the lookout for that. I'll also include the chat and the recording just in case you want to watch anything back. So thank you all
See your cute
so
faces.
much. I hope you have a great rest of the week.
Happy
Christine,
Wednesday.
Angie, always good to
Thank
see you.
you.
See ya.
Bye.
Bye bye.